Katie, what you got? Do you remove sebaceous cysts? Yes. Have implants and have one near breast that is becoming sore. So have implants and have a sebaceous cyst that is becoming sore. Gotcha. So yes, for sure, remove sebaceous cysts. I'd be a little bit worried about a cyst near an implant because presumably, don't want to make any presumptions here, but presumably it's a breast. Could be an implant somewhere else, but presumably it's a breast. So you can't. If it's a breast, you might be in the realms of, is it a breast cyst? So if it's clearly a sebaceous cyst, so if it feels like it's part of the skin, and particularly there's a little punctum and it's an obvious sebaceous cyst, fine. Although it would leave a scar where the cyst is, and scars on the breast don't tend to heal well unless we can maybe put it around the areola or hide it somewhere. But when you've got a cyst, you kind of have to put the scar where the cyst is. So you know, that's a bit of an issue that you might have a scar there. But if it's not obviously a skin thing, and if it's kind of like a little bit mobile, a little bit underneath the skin, I'd be thinking, hold on a minute, is this actually a breast lump? In which case we get into the arena of biopsies, imaging, and what have you. It might not be straightforward. It might not be a straightforward cyst removal. It might be, but it might not be. But the fact that it's near the breast is, the fact that you've got implants is kind of irrelevant, really, unless you are going down the imaging and biopsy route, because they probably wouldn't do a blind biopsy of a breast lump when you've got implants in. They'd probably do it with ultrasound guidance, but there's no issue if you've got an implant in. It's just the fact that you've got a lump in your breast. Is it a sebaceous cyst, which isn't that common in the skin of the breast, or is it a breast lump, which is kind of a bit more common? So that's the way